Thank you so much for taking the time and joining us here today, and Karen as well. So let's get started with, as the mental health crisis continues to surge in the U.S., obviously it's really important to raise awareness to that and the impact of the clinical depression. So, can you please tell us more about the signs and symptoms of clinical depression, how common it is?
Yeah, so clinical depression, or what we call major depressive disorder, is a condition in where you have a predominantly sad mood, loss of pleasure from your daily life activities. But there are a host of other associated symptoms in clinical depression, such as changes to sleep, appetite, concentration, energy level. And at times it can become more severe and have thoughts of not wanting to live or suicidal thinking. When all that impacts your day-to-day functioning, it makes it harder to carry out your daily activities, we would consider that, clinical major depression. Very common, maybe 1 in 10 adults in the United States have been diagnosed with it. So it is a very common condition.
So, treatment. What is treatment resistant depression, and what are the available treatments for that?
Yeah, so treatment-resistant depression is basically it's like a subtype or classification of major depression, specifically when somebody has tried two antidepressants and not found relief from them. They would be considered treatment-resistant depression, which is kind of why I partner with Johnson and Johnson and here today, like to really discuss treatment option for that condition specifically.
And what would you say when the medications aren't working for people? What do you do then?
Right. So, and there are, medications out there and other treatments, and everybody's different in what they might respond to. And I've seen a lot of success in when I've used a treatment option called Spravato, which is approved actually for treatment-resistant depression in adults that are already on an antidepressant. Even if that antidepressant's not doing everything it needs to do, you can add Spravato to that. It's a nasal spray. It's actually administered in a certified treatment center because they need to monitor for side effects that can occur during the treatment. So that is a treatment option that I've seen some good success with.
And let's take it over to Karen. Karen, can you tell us a little bit about your experience with treatment resistant depression?
Yes, of course. I'm a very optimistic person and hardworking, so um, staying in a depressive mood is not ideal for me. I don't like it. I don't want to stay in it, and that's why I had to seek the help from professionals because then Dr. Nazir was able to give me recommendations, and I started taking antidepressants. But then there was a point in my life where I was really struggling, and my antidepressant stopped working. So I kind of freaked out. I really didn't know what to do. I didn't understand what was going on because I was already doing all the right things. I was seeking my doctor's assistance, talking to my therapist, and leading a healthy lifestyle, and nothing seemed to work, not even my antidepressants. So Dr. Nazir was the one that saw the opportunity for the treatment Spravato, which we added, and I've been using that for the past 2 years, and it has made a difference in kind of helping me feel relief in those symptoms so I can continue to do my day-to-day activities.
For those that might not be aware of it, or are kind of in the same situation as you, can you kind of walk us through your current treatment plan?
Sure, yeah. I continue to take my antidepressants, continue to lead a healthy lifestyle, which I cannot stress enough. It's very, very important. There's no one stop shop medicine or treatment that's going to cure it. There's no cure, unfortunately. So continue to consult with Dr. Nazir for alterations on the medications. And of course, Spravato for the past 2 years has been a weekly treatment that I've been undergoing.
Thank you, Karen, for that. And Dr. Nazir, how can people help a loved one who has treatment resistant depression and is struggling to find the right treatment?
Yeah, so it's important to support that person, but more importantly also is to reach out for help and talk to a psychiatrist if you don't have one, a primary care physician, therapist, but speak to a healthcare professional If you're, want to explore further and learn more about that medication option that we've been, brought up here today, and that would be going to the website, bravado.com. And if you're more immediate help you need and it's more of a crisis, you can always phone or text 988, which is the suicide crisis lifeline.
Well, thank you. Thank you, Dr. Abid and Nazir, for joining us today, and Karen for sharing your story. And you guys have a really good day.
Thank you.
You too.
Thank you.